Hey there, I'm Dr. Tingle. I see we have you in for a little physical exam today, and also it looks like you want to discuss your anxiety you've been having. Is that right? Alright, just come on in, have a seat for me, and we'll take a little look at you. Just going to sanitize my hands real quick. Obviously, we can't be introducing any germs here. So, why don't you tell me a little bit about what's going on? What's causing you anxiety? Is it work? Is it stress from work, life, relationship? Or is it just one of those kind of things that you're feeling every single day? Kind of feeling a little tightness in the chest? Maybe just small things kind of trigger you, set you off a little bit? Yeah. Alright, well, we can definitely talk about that today, talk about some strategies to help you cope with that a little bit, and maybe some future treatment plans. But in the meantime, I'm just going to take a look at you, just a general physical exam, make sure that I'm not seeing anything that could be causing you any kind of physical distress, which could be causing that anxiety. So, if you don't mind, I'm going to get just a little close to you here. I'm just going to look around your face a little bit. Okay. You let me know if you feel any pain or discomfort at all. I'm just going to gently palpate down your nose. Okay, good. I'm just going to run my fingers along your sinuses, right under your eyes there. Okay, good. Alright. Just looking at your skin. No signs of sun damage, which is good. Alright, so where did I put my little oxygen monitor? Here we go. So I'm just going to get some vitals from you. Alright. So I'm going to use my little blood oxygen monitor here. And we're just going to open that and just clamp it on your finger just like that, okay? Alright, so just give me your finger real quick. And there we go. And while we're doing that, just going to take a quick listen to your heart, alright? So you can just sit back, relax. If you like, you can close those eyes. And I'm just going to listen to your heart real quick. Just breathe normally for me. Good. Okay. It's beating a little fast. It's alright. Don't have to worry about getting a doctor's exam. It's all good. Nothing to worry about, I promise. Well, heart sounds good. It's being a little fast. But let's check out. And blood oxygen looks good. So far so good. So why don't you tell me a little bit about your sleep habits? How's that been lately? You staying up a little late? Okay. You get a lot of screen time? And how much caffeine do you consume during the day? 6 cups of coffee. That's a little bit much, but we try to cut that back a little bit. Maybe increase the water intake. How about that? Yeah, it might actually help you out a little bit. Caffeine is a stimulant, and when you are having an anxiety response, that's your body's fight or flight response, and stimulants can exacerbate those really nasty feelings. So maybe let's lower that caffeine intake, up that H2O intake. See how I feel after that. But anxiety is a real pain in the ass. I know, I have it myself. It can be a really, really fun bedfellow to ADHD and a bunch of other things, or you can just have generalized anxiety disorder. And that's okay. Having anxiety is not your fault. There's no shame in it. So we are going to just continue our exam today. I'm just going to look at your eyes real quick. We're going to do some eye tests on you. The first one's just a quick pupillary test. I'm going to hold up my occluder here, just like so. And just like that. And I'm going to take my light and I'm going to swing it in. I'm going to swing it out. Swing it in. Swing it out. Swing it in. Out. In. Out. In. Out. Good. And let's do that other eye real quick. And in, out, in, out, in, out, in, out, in, and out. Very good. No issues there so far. But while we're looking at your eyes, I'm just going to use these lenses here real quick. And just hold it up to one eye. Does the light look blurry or can you see it okay? Okay, good. Good. And now we're going to do the other eye. Same thing. Is it blurry or is it the same? Okay, good. That's what I like to see. I want you to just look straight ahead at me real quick. And just follow my finger. Good. Follow my finger. Good. Keep following my finger and don't get distracted by this one. Follow this one, not this one. Good. 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 Alright. Look straight at my nose real quick. Do not follow the light with your eyes, just look straight at my nose. Straight at my nose. Good. Good. Alright, keep looking straight. Good. Good. Alright, now I want you to follow the light with your eyes, don't move your head. Good. Again, don't move your head. Just follow the light. Good. Good. How are you feeling so far? No, you feeling a little bit anxious? Okay. So we're going to help you with that real quick. We will help you calm down and let's relieve some of that anxiety real quick, alright? So just look at me. We're just going to breathe in real quick on a count of 4, just like this. 1, 2, 3, 4. It's going to be, and we're going to hold it to 1, 2, 3, 4, and let it out. Okay. Alright, so let's just breathe in. Hold it. And let it out. Do that a few times. And then I'm going to share with you a little secret that I found. And this will help with anxiety in the moment. But you can kind of trick your brain and your body into ignoring that tightness in your chest by sucking on a sour candy. So this one is my favorite, called Toxic Waste. Got blue. Got pink one, which is watermelon. I got a yellow one, which is lemon. And then we got apple. So the thing is, the sour candy will help distract your brain from those anxiety feelings and help you calm down. Do you want one? The watermelon. Good choice. Good choice. Let me just get one of these open for you. And don't mind if I do while we're at it. So here you go. And I'm just gonna have a blue raspberry one myself. So, you want to continue? All right. I'm gonna keep going with the eye exam portion. So, I want you to just read the letter that I point to. Good. Good. Mm-hmm. Mm-hmm. Good. All right. Good job. Good. Mm-hmm. Good. Mm-hmm. Yep. Good. Mm-hmm. Yep. This one. And that one. Good. Well, I have to say that your eyes are perfect. I would like to do some color recognition with you, just to make sure that you're not colorblind. So I'm just going to hold up a little color paddle here. You just tell me the color. Blue, very good. And blue again, good. Not going to fool you. Red. Green. And yellow. And last one, orange. Very good. Well, so far, everything is going absolutely perfect. Not finding anything wrong with you, but we're going to continue on with our physical examination. So we already tested those eyes. We're going to move on to testing your ears in a bit, but I'm going to look at some of your musculature now. So you can just relax, keep your eyes closed if you like. I'm just going to come and just gently feel around your neck here and your shoulders. Definitely feeling some tightness here. And I do know a good chiropractor who can help you loosen up some of those tight spots. Is that candy helping? Okay, good. Alright. And I'm just going to come down here. Just check out your arm. Okay. And your hand. Okay. You do seem to hold a lot of tension in your hand here. Let's check out the other arm on this side. Yeah, tends to. Look at this hand. I am definitely going to recommend you to a really, really good chiropractor. Alright, why don't we take a look at those ears. Just going to grab my otoscope here. And you just sit back, relax. You can close those eyes. And I'm just going to slip my otoscope inside. Take a look. Okay, well. Yeah, your ear looks good. Doesn't look dirty at all. Ear canal Let's check out the other side. Same thing. Okay. Yeah, it looks nice and clean here too. Not seeing any issues inside, but for the sake of thoroughness, we're going to do some ear tests on you. The first hearing test we're going to do on you is the Weber-Rhine test. So I'm going to take the tuning fork and ring it very gently. And I'm going to hold it right there in the front of your head. And you're going to let me know if it sounds the same or if you can hear it on one side more than the other, okay? Alright, so here we go. We're just going to very gently and... How's that sound? Good. We'll do it one more time. A little bit louder. Good. Alright, so now what I'm going to do is the same thing. So I'm going to hold it right here, behind your ear. And you let me know if you can hear that. Good. I'm going to do that one more time. Good. We're going to do the other ear. Good. Alright. Now I'm going to have you close your eyes. I'm going to whisper a word in your ear and you're going to repeat it back to me, okay? Alright, so close those eyes and relax. Good. Whisper. Good. Tingle. Chocolate. Good. Coconut. Vacation. Relax. Dream. ASMR. Herbal. Vibes. Clouds. Good. Alright, you can open your eyes. Go ahead and blink. Alright, so you passed out with flying colors. I'd like to do a little more hearing test on you. So close those eyes for me. And I'm just going to make a noise in your ear. Just like that. You let me know when you can no longer hear it, alright? Alright, so close those eyes and good. Very good. Mm-hmm. Good. Good. Very good. All right, go and open your eyes. Just going to make a quick note. All right, we're going to keep going with a few more hearing tests. Except this time, I'm going to ask you to just tell me when you can no longer hear the sound, okay? Okay, so just close those eyes and good. you can go ahead and open those eyes for me. We are going to now just do a little more physical examination on you. We're going to do a little reflex test on your joints if you don't mind. Okay. Because I did notice that your muscles are very, very tense. And being that you do have a little bit of anxiety, I can understand that, but chin up. We're going to help you feel a lot better. Why don't you just go ahead and give me that arm. We're just going to test that elbow. 1, 2, 3, and good. And down the wrist. 1, 2, 3, and great. To the other arm on the elbow. 1, 2, 3, and good. And on the wrist. 1, 2, 3, and great. And check your knees down here. Just let that knee hang for me. 1, 2, 3, and good. We're going to do that one more time. 1, 2, 3, and good. Let's get that other knee. 1, 2, 3, and good. One more time. 1, 2, 3, and good. All I have to say, so far, physically, not finding anything wrong with you. We are going to do a little sensation test on you so that we can make sure that we're ruling out any kind of physical problems, but I'd say that your anxiety, like mine, definitely mental, and you know what? It's not your fault. It's nothing to be ashamed of. Plus, they make things that can help us with that. And there's plenty of other things that can help, as I said. Lifestyle changes, like reducing caffeine intake and stimulant intake. Same with processed foods. Exercising. I know it's not fun, but exercise is good for the brain. It helps raise up that serotonin and that dopamine. And, of course, getting a good night's sleep, which listening to ASMR before you go to bed can definitely help with that. So why don't we do a sensation exam on you, just to make sure that you can feel things other than anxiety. And then we will get you to just drift off to sleep tonight, okay? Alright. So we're going to start with something super simple. I'm going to use the soft little fluffy brush. And then the little tip, I'm going to have you close those eyes. And I'm going to just touch you with one. And you're going to tell me what it is, okay? Alright, so just close those eyes. And soft, good, and dull, soft, dull, very good, soft, dull, soft, dull, very good, soft, soft, very good. I want you to keep those eyes closed for me. And we're going to bring in another object, and you're going to tell me this time, is it the fluffy brush or the regular brush? Fluffy or regular? Alright, so keep those eyes closed for me. And fluffy, good. Regular. Regular. Fluffy. Regular. Regular. Fluffy. Fluffy. Regular. Regular. Fluffy. Fluffy. Regular. Good. We're going to do a 2-point test, so I'm going to use this very dual pair of tweezers, and we're going to do the same thing, except you're going to tell me if you can feel 1 point or both points, okay? Okay. So just let me know if it's 1 or 2. 1 or 2. All right, and 1, 2, 1, very good. 2, 1, 2, 2, 2, good, and 1. All right. Well, my friend, you can open your eyes. I have to say that physically, nothing wrong with you, but we can definitely help you deal with that anxiety. So we talked about some lifestyle changes we can work on today, and I'd like to see you back in a few weeks, and we can discuss a plan to get you on some anxiety treatment and maybe a special recommendation for some herbal treatment that I find helps with anxiety quite a lot. But in the meantime, I'd like you to go home, relax the rest of the day, drink plenty of water, and get a very, very good night's sleep tonight, okay? Alright, and we'll see you again soon.